So today I'm happy to give this webinar and give you a little bit of an understanding on how physical activity can improve survivorship after cancer. So the presentation will be focused on survivorship, since this is what your group is interested in. So here's an outline of what I'm going to be discussing. I'll start off with just giving you a theoretical framework for the research that I've been doing on physical activity and cancer control, and then we'll talk about specifically how physical activity can assist in coping, rehabilitation, prognosis, and survival after cancer, and I'll be looking at that specifically by different cancer sites. I'll provide you some of the evidence from observational studies, also randomized controlled trials. The main focus will be on breast, colon, and prostate cancers, and then I'll end with some of the outstanding research questions that we still have to address. This is the framework for the work in physical activity and cancer control that I've developed with my colleague Carrie Curnier at the University of Alberta. So what you can see here is there's this period of pre-diagnosis, diagnosis, and post-diagnosis as the cancer-related time periods that we've identified. And essentially what we said was there is the possibility of having an impact on this trajectory, this cancer continuum, all from prevention right through to survival, and with some exercise interventions. And so what we've been doing over the last 20 years or so is targeting studies along this continuum. Today I'm only going to be focusing on the post-diagnosis period. So this slide here shows you what the state of the science is in physical activity and cancer research. We have three different colors representing a strong, modest, or limited evidence base, and this has been adapted from work done by Dr. Neville Owen. Essentially what we can say is that we now have very good knowledge on how physical activity is related to cancer risk. There have been over 300 studies that have been conducted that have looked at some aspect of physical activity and cancer risk. There's less evidence on how physical activity is influencing cancer survival, with around 40 studies that have been conducted to date. There's also a more modest evidence base examining how the underlying biology that would explain how physical activity can influence cancer risk and survival. And there's a very limited evidence base understanding exactly what is the prevalence and determinants of physical activity in cancer survivors, and what kind of interventions can we use to increase physical activity for cancer prevention and survival. Ultimately, all this research is aimed at trying to improve the evidence base for informing programs and policy around cancer control and physical activity. So I'll start off explaining what research has been done from randomized controlled trials of physical activity in cancer survivors. So there was a very nice review published in 2010 in the Journal of Cancer Survivorship by Speck and colleagues that looked at the influence of physical activity by cancer phase, so during treatment and post-treatment during the survivorship period, and looked at how physical activity might actually influence a number of different characteristics and patient-reported outcomes. And so what you can see in this slide is that there's now very good evidence from hundreds of studies actually that have looked at some aspect of an exercise intervention during these two different time periods, and they've found that if you encourage cancer patients and survivors to be physically active, it actually has a beneficial effect on improving their physical activity levels, their aerobic fitness, their upper and lower body strength, as well as decreasing their body weight and percent body fat. In addition, we also know that physical activity can very much decrease fatigue and levels, improve quality of life, improve physical function, decrease levels of depression and anxiety. And it seems that the effect is somewhat stronger during the survivorship period when we compare all of these studies. Now I'm going to focus on some of the research that we've done on physical activity during cancer treatment. The first study that Carrie Curnier and I conducted along with our colleagues at the University of Ottawa and University of British Columbia was a three-armed trial that was looking at the question of whether we could take breast cancer patients during their chemotherapy treatment and put them on an exercise intervention that was either an aerobic exercise intervention or a resistance training intervention during the approximately 17 weeks of their treatment. Just to put this in context, when we first started our research activities in the early 1990s, There was a lot of resistance from the medical oncology community to doing any kinds of vigorous interventions, particularly during treatment with cancer patients. So this is the first study that we conducted, and what we did was we randomized the patients into these 3 different arms. The supervised aerobic training group did 3 times per week of aerobic activity that was 60 to 75% VO2 peak. The second group was doing a progressive resistance training program, and the third group was usual care, so they had no intervention. In total, we had 242 women in these 3 centers across Canada. So the main results from the START trial were that aerobic exercise was better than usual care for improving self-esteem, aerobic fitness, percent body fat, and fat mass. And resistance exercise was better than usual care also for self-esteem, lower and upper body strength, and improving lean body mass, which is what we would expect. And the unexpected finding, which was very important, was that the chemotherapy completion rate was actually higher in the women who were doing resistance exercise. So this was a very intriguing result, and I must say it was also one that helps bring aboard a lot of medical oncologists and radiation oncologists to understand that it was actually a beneficial thing to encourage patients to be physically active during their treatment. In addition, we also found some improved patient-reported outcomes, although these were non-statistically significant. So as a sequel to the START trial, we were able to look at what the outcomes were in these participants. And so this is the first ever trial that actually followed up the women to see what kind of survival outcomes were experienced in these participants. So this was just an exploratory analysis. We weren't really powered for a full-born survival analysis, but we did see an indication that there was improved survival in the 2 arms of the trial that did some form of exercise versus usual care. So as preliminary evidence, this was quite encouraging to show that even 8 years after the exercise intervention, we could see some improvement in survival. We also saw a little bit of an improvement in overall survival. This START trial was then followed by the next trial, which was the combined aerobic and resistance exercise trial, the CARE trial. And here we were asking the question, what is the optimal combination of aerobic and resistance exercise training for, again, these patient-reported outcomes, which was the main outcome in all of these trials. In this trial, we used the same 3 centers, Vancouver, Edmonton, and Ottawa. We increased the sample size to 300. And we had 1 arm that was just doing moderate supervised aerobic training. We had 100 women in that arm, and they did 75 minutes per week at 60 to 75% of VO2 max. So that would be sort of the baseline level of aerobic training that we had before. And then we had the high supervised aerobic group, which was doing double that amount of exercise, 150 minutes a week. And then we had the combined group of aerobic and progressive resistance exercise training. So in this trial, we found that we had fairly good exercise adherence in all 3 arms of the trial, with somewhat better adherence in the moderate aerobic exercise group, which would be expected given that they only had to do 75 minutes per week versus the 150 minutes per week in the 2 other arms. But you can see that across these 2 arms, we have fairly equal exercise adherence. So what did we find? In the high aerobic activity group, the ones that were doing 150 minutes per week, we found better results for physical health, bodily pain, fatigue, physical fitness, and endocrine function compared to the standard therapy group, which was the 75 minutes per week. And then we also found in the combined aerobic and resistance activity group that they had better results for muscular strength and endurance, which is what you would expect. Next, I'm going to just talk about some of the observational epidemiologic research studies that have been done on physical activity and breast cancer survival. So we now have about 21 studies that have been conducted that have looked at some aspect of physical activity done either before diagnosis or post-diagnosis, and have followed up the cases in these studies for survival outcomes. And what we can see for breast cancer mortality is that there's about a 23% risk reduction for those participants in these studies who were most physically active compared to the least active. And for post-diagnosis physical activity, we found an even stronger effect with about a 35% reduction in breast cancer mortality. When we look at all-cause mortality, we can find even stronger effects. And of course, for all of you who are on the call, you would recognize that there are large impacts on overall mortality associated with chemotherapy, for example, cardiotoxic effects. And so we know that being physically active actually can mitigate some of the effects of treatment, and also being physically active also helps reduce some of the other major causes of mortality. So you can see here that the women who were most physically active after diagnosis compared to the least active had a 40% reduction in all-cause mortality risk. So these are very, very large reductions that we're seeing from these studies. The first study that I just would like to highlight is one individual study that was published was by Michelle Holmes and colleagues. They did an analysis in the Nurses' Health Cohort study. And here you can see that they found a strong effect of a physical activity already at 3 to 5 hours per week for a reduction in breast cancer mortality and all-cause mortality, as well as reducing the risk of recurrence. So these were very exciting results when they first came out in 2005. In Alberta, we did a similar research studies. We had a case control study that was done across Alberta that included around 1,200 breast cancer cases, incident cases, and about 1,200 controls. And we did a cohort follow-up of all of the cases. And what we found was that the women who had the highest levels of recreational activity, and this was lifetime activity measured at the time of diagnosis, and it included all activity from childhood right to diagnosis. And so here we found a statistically significant improved survival amongst those women with highest levels of recreational activity. This has recently been a paper published by Zhang et al., where they were actually looking at the question of, is there a dose response between pre- and post-diagnosis physical activity and breast cancer-specific mortality? And there does appear to be this kind of a nice dose-response curve that you can see that they've plotted here. And essentially what they're showing here that is with a 3 MET hours per week increment in pre-diagnosis physical activity, you're seeing about a 5% decreased risk of breast cancer-specific mortality, and about with a 1 MET hours per week increment in post-diagnosis activity, you're actually getting a very large effect. So it does seem like post-diagnosis physical activity is particularly important. And so from a public health perspective, we can be telling our cancer patients and survivors, even if they've been physically inactive pre-diagnosis, if we encourage them to become physically active after diagnosis, they can have experience a benefit in their survival. In our cohort study in Alberta, we were also interested in the question of what type of physical activity is related to an improvement in breast cancer survival, and you can see that we found the strongest effect with leisure or recreational activity and less of an effect for household or occupational activity. And we also looked at the question of how intense does the activity have to be, and we did find the biggest benefit with moderate intensity activity. It should be noted that in this particular population, we did not have large levels or high levels of vigorous intensity activity. And again, from a public health perspective, this is a good message to be giving our patients and survivors, since moderate intensity activity is something like brisk walking, which is achievable for most individuals. The World Cancer Research Fund and the American Institute of Cancer Research just published a continuous update project report in November of 2014 that was looking at what is the current evidence on diet, nutrition, physical activity, and breast cancer survivorship. And their conclusion is that there is currently still limited evidence for a role of physical activity before or after diagnosis on breast cancer mortality or all-cause mortality. Now, it must be noted that the WCRF and the AICR have very stringent rules for evaluating evidence in a particular topic. And so when there hasn't been very much research on a topic, then usually it's classified as limited. So even though we are seeing very strong effects, because we haven't had that many studies done yet in this area, it's still being classified as limited. They further stated that for all-cause mortality, before a diagnosis of primary breast cancer, the evidence was limited but generally consistent, and the evidence was suggesting that being physically active before a diagnosis of primary breast cancer, which reduced all-cause mortality, was still limited, and the same thing for breast cancer mortality. But they are finding consistency of evidence, which is what I was also able to show you in the slides that we looked at. And then for physical activity done after a diagnosis of primary breast cancer, they said that there was ample evidence from follow-up studies which was generally consistent, and that there was evidence of a dose-response relationship. But because of the possibility of confounding and the fact that we haven't got any evidence yet from randomized controlled trials, they were still classifying the evidence as limited for activity done 12 months or more after diagnosis of primary breast cancer. So as you can see, there's still room for trying to understand more about how physical activity and physical fitness actually influence survival after breast cancer. So Carrie Kearney and I decided to launch a team grant that was funded by the Key Institutes of Health Research in 2011 to try to address this question of how does physical activity and physical fitness influence survival after breast cancer. So we have a study ongoing right now that we're calling the Alberta Moving Beyond Breast Cancer Cohort Study, the AMBER study. We're recruiting 1,500 newly diagnosed stage 1 to stage 3C breast cancer cases in Edmonton and Calgary. And we are enrolling them in this cohort at the time of their diagnosis. We're asking them to complete a number of questionnaires and go through a full battery of physical activity and physical fitness tests, which I'll explain more in a moment. And we're measuring determinants of physical activity, patient-related outcomes. We're also taking blood samples from them so we can look at some of the biomarkers, and we're doing very detailed assessments of lymphedema. These are done at the time of diagnosis, and then again 1 year post-diagnosis and 3 years. And at 5 years, we are just having them complete the questionnaires. And we're following them up for an additional 5 years for all mortality outcomes. And what we're trying to answer is how can physical activity and health-related fitness be used to inform clinical recommendations for improving patient-related outcomes in survival in breast cancer survivors. So as this is a program project team grant, we have 5 individual projects that are being led by 5 different PIs. Carrie Kearney is leading the study that's looking at the primary outcomes of physical activity, health-related fitness, and disease endpoints. I'm leading the project on the biological mechanisms. Nicole Koulos-Reed is leading the project looking at the determinants of physical activity and health-related fitness in survivors. Jeff Valance is looking at patient-reported outcomes, and Margie McNeely is looking at the lymphedema outcomes. We have a lot of data that we're collecting, which is listed here on this slide, and we will be looking at all these different outcomes. This is the biologic model that we developed for this grant, and essentially we had 3 main pathways that we initially hypothesized might be important to explain how physical activity and health-related fitness might improve survival after breast cancer. So we are looking at one pathway that is through adiposity, and another one through inflammation, and the third one through insulin resistance. And with each one of these pathways, we recognize that we are going to have to be very cognizant of how hormone therapy, chemotherapy, radiation therapy also influence these pathways. So we're going to be doing very detailed measurements of all of their treatments that they have, as well as getting these biologic samples at these 3 different time points during their follow-up. The data collection for this study involves sending out a introductory package. We have a fitness evaluation that's booked for usually 2 days. And that assessment involves full anthropometric measurements, including a full body DEXA scan, a maximal fitness, cardiopulmonary fitness test, some muscular strength and endurance testing, flexibility assessments, lymphedema, and shoulder and arm assessments. They also are filling out a number of questionnaires and wearing an accelerometer. So we have, as much as possible, objective measures of physical activity and physical fitness. These are the health-related fitness tests that we're doing, and because of the nature of the testing that we are doing, we've decided to split it into 2 days because of the maximal fitness, cardiorespiratory fitness test, and so that's split and separated from the muscular strength and endurance tests. If someone's coming from out of town, we can do this all in 1 day. So we currently have been screening women for eligibility for the study since May of 2012, and over 5,500 women have been diagnosed with breast cancer during that time period in Edmonton and Calgary. About 1,800 were eligible and approached for the study. Over 600 received our study package. We've got 500 that have now completed the baseline assessments, and over 200 who have completed the 1-year assessments. And this summer, we're going to be starting with the 3-year assessments. So now I'm going to switch to talking about colorectal cancer. So this is another major cancer site where we have excellent evidence from observational studies that a physical activity done either pre or post-diagnosis has a very beneficial effect on both colon cancer-specific mortality and all-cause mortality. And here you can see again that the post-diagnosis physical activity is associated with very large reductions in colorectal cancer mortality of 45% and all-cause mortality of 46%. One of the first studies that was done was led by Jeff Meyerhart from, again, he conducted actually 2 studies, one first in the health professionals follow-up study and also in another intervention trial, and again found a very strong dose-response effect with increasing levels of physical activity and decreasing risks for colorectal cancer-specific and overall mortality. And this was with post-diagnosis physical activity. In fact, the evidence was so strong that it motivated the National Cancer Institute of Canada's Clinical Trials Group to launch the first ever randomized controlled trial of exercise in colon cancer survivors to determine whether being physically active post-diagnosis would lead to an improvement in mortality survival outcomes after treatment. So we are now conducting the so-called challenge trial, which is being conducted in 46 centers across Canada and Australia, and we're also opening up centers in Europe and the Middle East. And in this trial, the participants are randomized to one of 2 arms. The control arm just receives health materials, which is considered the usual care, and the intervention arm receives a physical activity program that is supervised, as well as the general health materials. We're looking to recruit 962 patients. The intervention itself is 3 years in duration, and they're followed up for mortality outcomes. The sample size was based on an expected hazards ratio of 0.75 for disease-free survival, and we would need to observe 380 events for that kind of power calculation. We have actually over 300 patients who are now currently randomized. We have published some of the results already from the study so far, and the reference is given on this slide. We have seen improvements in fitness, and we have had excellent exercise adherence so far. Now I'll just switch to talking about a little bit about prostate cancer survival. So again, coming out of the Harvard group in the health professionals follow-up study, Jennifer Kenfield published the first study that is looking at how physical activity post-diagnosis is associated with prostate cancer-specific survival and all-cause mortality. And again, we're seeing some very strong effects here with increasing levels of physical activity and decreasing risks. So we are currently conducting a similar study in Alberta. This was based on a case control study that we conducted here between 1997 and 2000, in which we enrolled 987 incident cases of prostate cancer. We, at the time of the case control study, we had all men complete an interview-administered questionnaire that measured their lifetime physical activity. We then, 2 years post that baseline case control study, we did our first follow-up, and we repeated the interview-administered questionnaire that captured all of their activity since the time of diagnosis. And then we started a series of chart abstractions to get all of the data on their stage, treatment, and all their outcomes, including any progressions, recurrences, new primaries, and mortality outcomes. And we did another second and third follow-up with the participants where we asked them to complete self-administered questionnaires on physical activity and quality of life. And now we have done the analysis on the 14-year mortality follow-up with 577 deaths, of which 236 were prostate cancer specific deaths. And we also had 401 recurrences and progressions during this time period. So what we found was, and this has been seen in other studies as well, that there is definitely a change in physical activity from pre to post-diagnosis that occurs. These analyses are restricted to the 830 men who were still alive at the time of the first post-diagnosis assessment. We have found that the post-diagnosis total physical activity is associated with improved prostate cancer-specific survival. So this is the first survival curve that I'm showing you here. And then we also found a very strong effect for all-cause mortality outcomes as well, with those participants who were the most physically active in the highest quartile, which are these individuals here in the blue line, having improved survival compared to those who were in the lowest quartile. We did look at the data in a number of different ways, including the question of, again, how is this association specific for different types of activity? And you can see here that we're finding the strongest effect with recreational activity. So this is, organized exercise sports activity as compared to occupational activity. We did measure both sedentary occupational activity and active non-sedentary occupational activity, and household activity being anything that was done around the home. I must say, with this particular population of prostate cancer survivors, we had very, very low levels of household activity, with a lot of the men not doing any activity before age 65, and then only doing some afterwards. So part of this result might be just the low levels of activity that we saw in this particular group. And you can see in all of these slides that we were looking at a number of different outcomes. Recurrences, lethal prostate cancer includes metastatic cancers as well as prostate cancer specific deaths combined. And again, we're finding a nice dose response effect with higher levels. In this slide, we're looking at vigorous intensity post-diagnosis physical activity. So the higher the levels of vigorous intensity post-diagnosis physical activity, the better was their survival after prostate cancer. And here we're looking at the question of sedentary occupational activity, and we found not very strong associations here. We've got the baseline group at 0, and for those who had the highest levels of sedentary activity, we had somewhat higher risks of lethal prostate cancer. We also looked at the question of patterns of activity from pre to post-diagnosis physical activity. So here in this table, you can see we divided the men by the levels of pre-diagnosis physical activity and post-diagnosis physical activity. So what I'm going to be showing you next is 4 different groups. We have the individuals who are sort of shaded orange here, who were those who had unchanged low or medium levels of physical activity. We had people in green who were physically active pre-diagnosis, but then became less active post-diagnosis, and then the ones in blue are the ones who became more physically active post-diagnosis, and then we have those in red who maintained highest levels of physical activity from pre and to post-diagnosis. And so what we were interested in seeing is whether if there was an increased level of physical activity, or if the individuals maintained higher levels of physical activity, did they actually see an improvement in their mortality outcomes? And that's, in fact, exactly what we did see, which you can see in this slide here. And here are the Kaplan-Meier survival curves. So the individuals in green at the top were those who had the highest survival rates. They were the ones who had unchanged high levels of physical activity versus the group on the bottom in the red line, or who had the unchanged low to moderate levels of physical activity. And we can see that there was a somewhat improved level of survival for those who increased their levels of physical activity, but it nearly hits the same curve as those ones who decreased their activity. So I'm just going to quickly mention some of the evidence on sedentary behavior and cancer incidence and mortality, since sedentary behavior is emerging as another independent topic from physical activity that we need to be considering when we're looking at both cancer risk and cancer survival. And there have now been, I would say, about 30 studies or so that have, or maybe even 40, that have looked at the association between sedentary behavior and cancer risk by site. And you can see that we've got nice evidence that being sedentary or inactive, or spending too much time sitting, increases your risk of colorectal cancer and endometrial cancer, as well as lung cancer. The evidence is not as strong for some of the other cancer sites, but that's mainly because we've had very few studies done on those other cancer sites. In 2011, I spent some time with the American Institute of Cancer Research trying to come up with an infographic on how we could provide the general public with information on not only the importance of making time for being physically active, but also breaking up periods of sedentary activity. And so this infographic produced by AICR shows 4 different individuals who have different levels of physical activity as well as periods of sedentary time. And on the bottom, you see someone who has a lot of sedentary activity and very little physical activity. And on the top is an individual who spends quite a lot of time being non-sedentary. And so the idea being here that if you combine the two of being physically active and breaking up periods of sitting, you would reduce your risk of cancer. There's now evidence on how sedentary behavior is associated with mortality, and we can see that the evidence is actually quite consistent. 5 out of 5 studies that have looked at some aspect of physical activity and looked at mortality outcomes have found all statistically significant results with high levels of sedentary behavior being associated with an increased risk of all-cause mortality. And for cancer-specific mortality, we also have a lot of consistency with 10 out of 11 studies showing an increased risk. 3 of those were statistically significant. And same thing with some of the cancer survivorship studies shown at the bottom. So to conclude now, you can see that this is an area that has received an enormous amount of research attention in the last 20 years, and that we've made great progress in understanding more about how physical activity is actually related to all aspects of cancer control. There's definitely a need for more observational, epidemiologic, and randomized controlled trials to explain exactly what type, dose, and timing of activity needs to be done before, during, and post-treatment, and how that's related to both cancer risk and cancer survival. We've begun using more objective measurements of physical activity and physical fitness and sedentary behavior in these studies, which is excellent as a way of reducing some of the measurement error problems that exist with recall of physical activity, particularly over lifetime. There's a lot of possibility of effect modification by other factors that hasn't been explored fully yet, that I think definitely needs to be looked at. There's been very little research that's looked at late-stage and metastatic patients And these individuals are actually often excluded from studies because of the concern that physical activity might be too strenuous for them. But this may actually be a group that could benefit immensely from physical activity, and they warrant having more research done on them. We also need to understand more about how treatment-related complications could be alleviated with physical activity, and how patient-reported outcomes, health-related fitness could be improved. So even though I've shown you some evidence in those areas, there's definitely still some unanswered questions. And finally, an area that I'm quite interested in is trying to understand the underlying biology with mechanistic RCTs that would be looking at specific doses and types of physical activity, and of course, ultimately looking at survival outcomes. We only have the challenge trial as the only ongoing randomized controlled trial being done anywhere worldwide that is looking at mortality outcomes, but that's the ultimate objective in this research area. I think that in physical activity and cancer survival research, we do need, as I mentioned, some large-scale trials that have prolonged exercise interventions that could be looking at both recurrence and survival outcomes, and that will be looking at all these questions around different doses and types of physical activity and how those influence these different biomarkers. The American Cancer Society and the American College of Sports Medicine and a number of other bodies internationally are starting to think about what kind of recommendations we can give now for cancer survivors regarding how much physical activity they could actually do during treatment and post-treatment. And these are the general recommendations that have been developed thus far. All survivors are encouraged to avoid inactivity or a sedentary lifestyle and to return to their daily activities as soon as possible. They're encouraged to engage in daily physical activity, and this activity should be tailored to their abilities and preferences. The general recommendations are to do 150 minutes per week of moderate intensity or 75 minutes per week of vigorous intensity activity. This would be aerobic activity, and the recommendations also include 2 to 3 sessions of strength training or resistance exercise per week, and the importance of stretching all major muscle groups on days when exercise is done is also being emphasized. So in conclusion, I've shown that physical activity improves survival after breast and colon cancers by 30% or more, and that we also have a number of improved patient-reported outcomes as well as physical benefits. We've shown that physical activity is safe and feasible and efficacious when it's done during and after cancer treatment with no negative side effects at any dose type or timing of activity. That these interventions can be implemented widely to improve patient-reported outcomes even before the optimal type and dosages are determined, since no substantial harm with prognosis benefits seems likely. And that I've shown you, and I haven't spoken about it very much, but there are definitely individual groups and centers around the world that are starting to develop physical activity and cancer programs for cancer patients and cancer survivors. We need to be thinking about exactly how these programs will be sustained financially and operationally so that they can be disseminated more widely and so that patients can actually benefit from the knowledge that we've gained on how physical activity is related to cancer control. So in summary, the ultimate objective of all of the research that we're doing is to provide more quantitative data for enhanced public health recommendations regarding physical activity type, dose, and timing for both cancer risk reduction and improved survival. And I've shown you on this slide some of the guidelines that have been developed by the American Cancer Society and the American College of Sports Medicine. So my last slide, I just want to acknowledge the funding that I've had in my career from the Canadian Institutes of Health Research and Alberta Innovates Health Solutions, as well as the Alberta Cancer Foundation, and the research funding that I've received from the Canadian Cancer Society, CIHR, and the ACF, and the very good collaborations that I've had with a number of different individuals, but primarily with Carrie Crinier at the University of Alberta, as well as the staff and trainees that I have here in my Department of Cancer Epidemiology and Prevention Research with Alberta Health Services. I'd be happy to answer any questions that anyone might have.